Hi everyone, welcome back to MediLab EDU Talk. In today's video, we'll be talking about agranulocytes, an important group of white blood cells that play a vital role in our body's immune defense system.
Agranulocytes, white blood cell, WBC, that lack visible granules in their cytoplasm when stained and viewed under a microscope. There are two main types: lymphocytes, monocytes.
Small lymphocytes, size, approximately 6 to 10 micro-m, nucleus, round or slightly indented, occupies most of the cell. Cytoplasm, thin rim of light blue cytoplasm. Size sad face, approximately 12 to 15 micrometers, nucleus, dark purple or deep blue. Cytoplasm light blue, nucleus 3/4 th of the cytoplasm.
Lymphocytosis, increased lymphocytes. Common causes include viral infections, infectious mononucleosis, mumps, measles, rubella, cytomegalovirus, CMV, and hepatitis. Lymphocytopenia, decreased lymphocytes. Common causes include viral infections, HIV, COVID-19, influenza, severe autoimmune disorders, systemic lupus erythematosus, SLE, bone marrow suppression, from chemotherapy, radiation, or aplastic anemia.
Monocyte, size, about 15 to 20 micrometers, micro-m. The largest white blood cell. Nucleus, kidney-shaped or horseshoe-shaped, located eccentrically. Stains pale purple or bluish-violet. Cytoplasm, abundant, grayish-blue, often with a ground glass appearance. May contain fine azurophilic granules, though still classified as agranular. Monocytes transform into macrophages in tissues and are responsible for phagocytosis and antigen presentation. Clinical importance: monocytosis, increased monocytes, chronic infections such as tuberculosis, syphilis, and brucellosis, chronic inflammatory conditions or certain leukemias. Monocytopenia, decreased monocytes, bone marrow suppression, chemotherapy, or aplastic anemia. HIV and during stress or corticosteroid therapy. If you found this video helpful, don't forget to like, share, and subscribe to MediLab EDU Talk for more medical lab science videos.